I'd like to talk to you about a new mobile pain treatment program in North Carolina for peripheral neuropathy. So, everyone out there watching this, if you have neuropathy, you know exactly what it is. It's painful, burning, numbness, tingling, all the different symptoms that are uncomfortable. Everyone knows it's a problem too. It's also very difficult to treat, and you probably know that as well. Most of you out there, you've only ever been given meds and scripts to cover it. And so, a lot of these medications, you probably know this too, they wear off after a while. And most of your primary care doctors, that's the only real option they have for neuropathy is just medications, right? And they know they wear off. And after a while, they keep upping the doses and you keep working on, medication management to try and, keep working on the pain relief. And it just keeps on getting worse and worse. And over the years, the meds wear off and the pain stays there. So everyone knows this is a problem. And I've talked to a lot of pain doctors out there. And, you as a patient probably get referred to a pain doctor to handle your neuropathy. There's not very many options. Even the pain doctors I talk to tell me there's just not a lot of great options for peripheral neuropathy. So neurofunctional pain management is the best, in my opinion, and a lot of people's opinion, the best possible option for peripheral neuropathy. And we'll talk about what it is here in just a second. So neurofunctional pain management, it consists of three components. It is electroanalgesic therapy combined with IV nutritional hydration and health coaching. So what exactly are all these things? I'll tell you this. So electroanalgesic therapy is a high pulse electrical current. It depolarizes pain neurons and inhibits the pain signal to the brain. And in doing so, it de-escalates the pain inflammation cycle. So if you've got pain occurring from a certain area, you inhibit the pain signals, and now you've actually de-escalated that process. The inflammation resolves a little bit in that area every single time you do the treatment, and it gets better and better over time. In addition to the depolarizing the neuron, you're actually creating the release of neurotransmitters. So you've got endorphins, enkephalins, and GABA, which are three neurotransmitters that are released in the process of the treatment. All three of those make you feel great. Those are, everybody knows endorphins, right? And a lot of people will describe the way you feel after treatment as kind of like a runner's high. I feel good. I feel just physically good after getting a treatment. So you have the pain relief aspect, the neurotransmitters release, and then now you've also got the IV hydration component. So most chronic patients out there are chronically dehydrated, chronically nutritionally deficient in one or more vitamins and minerals. And so the ability to be hydrated, fully hydrated, really adds a lot to this program. So getting all of these vitamins, minerals built back up over time, and the hydration component really assists in the pain relief process. So that's part of it, and you'll actually notice this when you do this. A single treatment, especially with the IV portion, you'll feel great for days and days afterwards. And so it really does assist in the overall pain relief process. The third component is health coaching. And a lot of you are thinking, I probably don't need health coaching. I know how to be healthy. I'm just not doing it. But when I get out of pain, then I'll be healthy again. Well, that's exactly what we've seen with hundreds of patients, maybe thousands of patients have seen that once they start getting out of pain, there's a new motivation to actually be healthy again. And getting into pain, if you are in pain currently, there's just not a lot of motivation to eat healthy because you're in pain all the time. You can't get exercise, or there's little motivation to get up and start doing stuff because you're in chronic pain. So you don't really want to get a lot of exercise. And then, of course, you're sitting a lot of the day, and you're also taking other medications and things that actually also interfere with, normal, healthy physiology. So all these things contribute to the problem. But once you start getting out of pain, all of a sudden there's a light at the end of that pain tunnel. And the moment you see that, you're like, oh my gosh, I can get out of pain. This program works. I'm going to be healthy again. And you start wanting to go through all the steps and actually create a healthy lifestyle. The nurse who's working with you is going to do this. With every single visit, they're going to go over a health topic and they're going to work on plans and outlines for how you can actually be healthy and get out of pain and get healthy along the way. So that being said, the program itself, neurofunctional pain management, is an 8-week treatment program where you're being treated twice a week for an hour in your own home. Now, with our mobile program, this is all happening in your home. So you don't even have to go anywhere to make this happen. It's coming to you. So that's the program. And how effective is it? That's the next question I typically get. Across the board, with all the doctors we've worked with over the years, 85% of people are going to see a greater than 50% reduction in pain. that's the estimate, that's the outcome. That's what we're seeing across the board with all the different pain conditions. 85% successful. So that's what we're looking at. Most pain doctors will consider a 50% reduction in pain to be very successful for that patient, especially if it's a chronic pain condition, because they've had it for years and it's not ever gone away. So having a 50% reduction is very successful. We probably see somewhere between 30 to 40% of those patients, or of all the patients, actually getting a fully resolved or just nearly resolved, pain outcome. So a lot of patients are going to end up just fully out of pain. You'll do the program and you'll be out of pain and you'll feel great. That being said, how long does it last is the next question. You're typically looking at several months is most common. We aim for a 3 to 6 month outcome. So when you finish the 8-week program, you have an additional 3 to 6 months of ongoing pain relief. That's very common. We actually are aiming for 3 to 6 months, but a lot of people do extend past that. I've seen hundreds of patients go over 6 months still in pain relief. And I've even had patients that have gone over a year and they're still out of pain. And I've had patients come back into the office after a year saying, I'm just now starting to have pain come back. I'd like to get back into the program. So you can absolutely go quite a long time with relief. So that being said, that's the overall program. And I didn't mention this yet, but it is covered by Medicare and commercial insurances. So all of you watching out there, that it is covered. So our mobile team will come to you. The treatment itself is covered. Most of you have, regular insurances that will cover this. Some of you probably have some specialty insurances and things and HMOs like that. And some of those might be restrictive on letting you do much of anything. So we'll do what we can. But the best way to see if we can get you covered is go to the link on the description here. I have a link that will show you, just take you to our Get Started page. Fill it out. We have an insurance section there. You can fill that out. And our team will go to work, do a verification, and see what you're looking at with your insurance, because we'll call them, we'll figure it out, see what you can get, for coverage. Most of you out there are going to be able to be covered just fine and get started in the program. So I encourage you to reach out to us. Let us help you get out of pain. Let our nurses come out and do this treatment for you, and let's get you out of pain. I look forward to seeing you, and my team looks forward to working with you. Thank you so much.